Hello everyone, I'm Dr. Alaa Musbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University. Today I'm going to speak with you about the list of contents of my new textbook of gynecology, published in Amazon recently. But before I start, I would like to thank my family who give me support in each second in my life. Also, I would like to thank my patients and my students everywhere in Mansoura and in every part in the world. Also, the young doctor everywhere, because the best time I spend in my life is that when I am with my students in the lecture hall or give them lecture electronic online lectures. So I would like to give them my thank and I love them all. Also, I would like to thank my friends and my colleagues and my professors in Mansoura and in different parts of the world. I would like to thank my university, Mansoura University, especially Faculty of Medicine, where I grow up and reach up to reaching my career right now as a professor of obstetrics and gynecology in OB/GYN department. So thank you everybody, and as I said, very special thanks to my patient who teach me everything every day in my life. Okay, let us start with the textbook of gynecology. It is divided into 8 sections. Each single section formed of some chapters related to each other and containing a reference at the end, and these references are updated. Okay, this is the cover of the textbook of gynecology, how it looks. And let us go our journey with the list of content of textbook of gynecology. This is the first section, including the anatomy of the female reproductive system, the embryology and the anomalies of the female reproductive system, chapter about the female genital mutilation, another chapter about the physiology of the menstrual cycle and abnormal uterine bleeding. Also, chapters about dysmenorrhea and premenstrual syndrome, puberty, the normal and the abnormal one, and the menopause and the complications of menopause. Also, chapter about the hirsutism and the amenorrhea and the polycystic ovarian syndrome. Also, infertility and the assisted reproductive technology and the complication of ovarian hyperstimulation syndrome. And this section ended by updated reference at page 148. Okay, this is the biggest, nearly the biggest section in the textbook of gynecology. The second section includes the genital displacement, including the pelvic organ prolapse, uterine inversion, and retroverted flexed uterus, and ended by updated reference at page 187. Then the third section about old complete perineal tear and rectovaginal fistula. I started this section with old complete perineal tear, description, etiology, how to diagnose and how to manage, and so on. Also, the rectovaginal fistula, the causes, how to diagnose, and how to manage. And lastly, the reference at the end of the third section at page 196. The fourth section, including urinary incontinence, different types of urinary incontinence, like stress incontinence, urge incontinence, and so on. So, also, genitourinary fistula, as regards the types of the fistula and how to diagnose and how to manage. And lastly, the reference at the end of the fourth section at page 211. The fifth section starts with the classification of genital tract infection, going through vulvitis and porcelain gland cyst, including also vulvitis in childhood and in adult. Then vaginitis, cervicitis, sexually transmitted infection, pelvic inflammatory disease, female genital tuberculosis, and female genital schistosomiasis. And lastly, end by reference of the fifth section at page 256. Sixth section start with the benign ovarian mass, then ovarian tumor, ovarian cancer, endometrial cancer and endometrial hyperplasia, cervical cancer, the screening program, pre-invasive cancer and invasive cancer, vaginal cancer, vulvar cancer, gestational trophoblastic neoplasia, and lastly, the reference of this section at page 349. The seventh section starts with endometrial polyps, uterine fibroid, adenomyosis, endometriosis, and end by references at page of 371. So seventh section belong to benign uterine lesions. Okay. Eighth section and the last section in the textbook of gynecology belong to contraception, different contraceptive methods, including the hormonal contraception, the IUD, and physiological methods of contraception, barrier contraception, local contraception, everything about contraception and how to choose the best method of contraception in this chapter, which ended by references at page 395. This is the textbook of gynecology published at Amazon.com. There is two forms, one Kindle 4 ebook and another one paperback, and both of them available at Amazon. Okay, this is the link of Amazon. You can search for the book there. Thank you. I'm Dr. Ala Musbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University.